The World Health Organization is warning over 100 million more people will be infected with COVID-19 by early next year as the Delta variant continues to rapidly spread. WHO Director General Tedros Adhanom Ghebreyesus spoke Wednesday.
Cases and deaths continue to rise. Last week, the 200 millionth case of COVID-19 was reported to WHO, just 6 months after the world passed the 100 million reported cases. And we know that the real number of cases is much higher. As I said recently, whether we reach 300 million and how fast we get there depends on all of us. At the current trajectory, we could pass 300 million reported cases early next year.
Today, we spend the rest of the hour looking at the pandemic in 3 of the hardest-hit countries, the United States, Indonesia, and India. Over the past 4 weeks, the 3 countries have accounted for over a quarter of all COVID cases recorded in the world. We begin in India, where the official COVID death toll is reported to be around 429,000, but many researchers believe it is at least 5 times higher. India suffered a devastating wave of infections in April and May. We go now to New Delhi, where we're joined by Barkha Dutt. She is an award-winning Indian television journalist and author of This Unquiet Land, Stories from India's Fault Lines. She's an opinion columnist with the Hindustan Times and the Washington Post. Her latest piece for the Post is headlined, "As an Indian, I am enraged by America's refusal to set vaccine mandates." Her father died of COVID in April. First of all, Barkha, our condolences on the death of your father. Can you talk about what happened to your father? In fact, he had gotten 1 jab or shot, is that right, of the 2 shots? And how you feel about the level of resistance and hesitancy around vaccines in the United States, how you connect the 2.
Thank you, Amy. Yes, my father had 1 jab and was scheduled to have the 2nd vaccine, in fact, in the week that he tested positive and eventually had to be hospitalized. Now, like I think many daughters in India today, I'm haunted by the what if, what if I had managed to get him a vaccine in time? The truth is that he got a vaccine just as soon as he could. The truth is also that while I'm enraged, as I mentioned in the Post piece, at what's happening in the United States, I was also somewhat enraged with my own government for not having anticipated the ferocity of the 2nd wave and not having moved quickly enough to order, procure, and manufacture more vaccines. That said, when we watch what's happening in the US from, let's say, Delhi, it is astounding that people who have access to vaccines are choosing not to get jabbed. And, it's anti-science, it's self-indulgent, it's a very first world white privilege, because large parts of the world do not have access to vaccines. And the crisis in my country is that we do not have enough vaccines. Otherwise, our vaccination program has been quite a smooth rollout. So there are serpentine lines of people waiting to get a vaccine. And our problem is there are not enough vaccines to go around.
And Barkha, the Modi administration has pledged to have every adult vaccinated by the end of the year. How likely is that, and what needs to happen in order to make sure that there are sufficient vaccines?
So just to give the audience some context, India otherwise manufactures 60% of the world's vaccine. We have experience with mass immunization programs, which is why, with the vaccines we have, our rollout has been pretty smooth. But and I need to underline this again and again, and which is why my blood boils to see what's happening in the US, we simply do not have enough vaccines to go around. So to give you the numbers, we're vaccinating, let's say on a good day, about 4 million Indians a day. We need to be vaccinating 9 million to meet that target that you just mentioned that has been set by the government itself. That is all adults vaccinated by the end of the year. We cannot do that unless we have just an explosion of vaccines in either the production pipeline or the market. And at the moment, rich countries, Western countries, have, in a sense, captured most of the vaccines. They have vaccines in surplus. And if their own citizens are not ready to use these vaccines, they need to send them over to countries that need them more.
Barkha, you've reported extensively from all across India about the impact the pandemic has been having, and also, of course, therefore, the urgency of getting vaccines. Can you explain what you've seen, and in particular, the impact of the poor on the poor as oxygen supplies have run out? You've talked about people lining up on the streets and dying on the streets, waiting for oxygen. Also, increased numbers of people now below the poverty line. Could you talk about that?
Yes, it's important to sort of say that we might be in what some call the lull before the next storm. But certainly what we have emerged from is a nightmare like one I have never lived through in my adult life. We were told that this virus is the great equalizer. There could be no bigger lie. In the first wave of the pandemic, we saw millions of poor Indians having to leave the cities and walk back to their villages during the lockdown because India opted to close down public transport in complete panic when COVID-19 first hit us. And I documented that journey. And, the humanitarian catastrophe was significantly, I would say, greater than the medical emergency. In the second wave, because we thought there would not be a second wave, once again, it was the poor who were disproportionately hit. Most of them, families that I met, had to take loans, mortgage, jewels, family heirlooms, maybe sell the only piece of land that they have just to be able to pay the exorbitant fees at hospitals that then made them sign consent forms, which basically I call modern day death warrants, because those forms said that if their loved ones were to die, let's say, because there wasn't enough oxygen in the hospital, there would be no legal liability that the hospital would have to face. And I literally saw people outside the shut doors of these hospitals dying on the streets, dying in ambulances, dying not from COVID, but dying, for example, because they couldn't get a bed or because they couldn't get access to oxygen. So we must recognize, and now we're in the next phase where amid hopes of a recovery, you are seeing salaried Indians lose jobs. You are seeing, daily wage workers unable to pay rent. You are seeing millions of poor children fall out of the education system as physical schools remain closed in large parts of the country. So when we talk about COVID, we must stop saying that the virus is a great equalizer, because it is anything but.
Barkha Dutt, in the United States, there's now discussion of the booster shot. It's going to go first to the immunocompromised. Now pregnant women are recommended to have the shot, and it looks like children will be coming up next, under 12. The Wall Street Journal has reported that India is now looking to access Pfizer, Moderna, Johnson & Johnson. Can you explain what the impediments are to reaching an agreement with these foreign companies to be able to get the mRNA vaccine in India, and what it means that they are so proprietary around their recipes, around their formulas?
Great question. Personally, I've been advocating lifting of the impediments and getting these vaccines to us as soon as possible. In particular, the mRNA vaccines have been tested for children, and we know them to be safe. And like I just mentioned, our schools, we're probably the only country in the world where mostly physical schools have not opened for more than 500 days. And because of the digital divide, because only 11% of India has access to a computing device, for poor children, this means no education. education. It means losing, for millions of poor children, it means no education at all. Because, and then in particular for girls, you know, in homes where, let's say, there's one smartphone, it means the boy will get the phone and not the girl, and those girls are then being pushed into child marriages. So I'm just explaining all of this to underline why that mRNA vaccine is so desperately important for countries like mine. The impediment is that the government is refusing to basically sign off a waiver on the liability of these companies should they be taken to court. And the argument is that liability waiver has not been provided to Indian vaccine manufacturers. There are some of us who are saying give it to everybody because that's what countries around the world have done. But unfortunately, you know, we are seeing a protracted negotiation over this indemnity clause. And it is unfortunate because I do not think we have the time to be quite this bureaucratic and slow-moving about it as we've been.
And Barkha, before we end, the last issue of the medical debts that millions of Indians have accrued as they've treated people suffering from COVID. Could you talk about that and the state of hospitals and clinics now dealing with COVID patients?
So for the point at which we are in, we're sitting at the precipice of a third wave. We do not know what the nature of it would be. We are seeing localized waves in our country right now. What I mean by that is that instead of there being like this national sort of a catastrophe, we are seeing this localized and the maximum number of cases coming from specific states, the southern state of Kerala, the western state of Maharashtra, and so on. And in terms of the deaths, I just want to make the point that, again, we do not know a few things. Personally, my reporting makes it quite evident to me, and I think it's evident to everybody now, that we have severely undercounted our dead. We have seen mass graves of abandoned bodies suspected to be those of COVID patients in our northern heartland by the banks of the Ganga River. I've personally documented 5 such mass graves myself. We have seen underreporting and the absence of counting at cremation grounds and graveyards. And, it's just important to say this, that we are a country where 1,300 people used to die from tuberculosis, another 1,300 from cancer every day. We are seeing a sharp fall in even the registration of those cases, which means that millions of Indians are not getting access to screening, to hospitalization for diseases other than COVID. And in my opinion, they are part of the casualty figures of this pandemic and should be counted as such, but we have no formal or official documentation of what might these fatalities be. Public health experts are warning against the familiar sort of complacency that cost us so gravely in the second wave. They're warning against that for the third wave. Nobody quite knows when the third wave may come. At the moment, the hospitals are not facing the kind of pressure and the kind of craziness that we saw, let's say, in the month of May. So fingers crossed, but can't afford to be complacent at all and desperately need those vaccines that so many Americans are refusing to take.
Barkha Dutt, we want to thank you so much. And again, our condolences on the death of your father. Also, you yourself had COVID. Award-winning Indian television journalist and author, founding editor of the independent digital news source Mojo Story. She's an opinion columnist with the Washington Post, and we'll link to her latest piece. As an Indian, I am enraged by America's refusal to set vaccine mandates. Coming up, we go to Indonesia, where the COVID death toll has topped 112,000, with more than half the deaths occurring in the past 2 months. Stay with us.